7:50 here on the Big 550 KTRS. October is Breast Cancer Awareness Month. Yesterday, we had a doctor on from Good Morning America, and during the conversation, the doctor was saying that mammograms was the gold standard. Well, off the air and on Twitter, created a bit of a controversy because some people are saying that's not the best. So we decided to go to an expert, world-renowned St. Louis University surgeon, Dr. Theresa Schwartz. Doctor, thanks for joining us here in studio.
Yeah, you're welcome.
All right, so what do you tell people? The thing off the air was that this woman contacted me via Twitter and said that her mother had a mammogram, wasn't detected, had an ultrasound, and that was detected. So she was upset that doctors are telling people that mammogram is the gold standard. What's going on here?
In terms of breast cancer screening, mammogram is the gold standard. However, it's not perfect. You can miss 10 to 20% of breast cancers with mammography. So it's usually used in conjunction with ultrasound.
Gotcha. So if you get a mammogram, you should then get an ultrasound as well?
Only if there's an abnormality. Mammogram is the best way to screen. Ultrasound does a good job of looking at targeted areas. So if there's one area that you're concerned about, ultrasound does a great job of characterizing it. But it doesn't do a good job of screening the whole breast. That's what mammogram's for.
Okay, so the rule of thumb for women, since this is breast cancer awareness, is what? What do you tell women?
In the asymptomatic woman, no palpable masses, no skin changes, nothing abnormal from a breast standpoint. Start screening mammograms at age 40. If you feel something abnormal, you got to bring it to a doctor's attention because any further testing, any further breast imaging requires a physician's order, and you should get a physical exam. But as long as you're asymptomatic, screening mammogram is the way to go.
Okay, so what about the
picture? It also doesn't do a good job of picking up calcifications or other slight distortions that we can see pretty well on mammogram. So even though we do miss some things on mammogram, it's still the best that we have in terms of screening.
What about self-examination? What are they telling women about that now?
They say you should do it at least once a month. I don't have any good data to say that it catches cancers early or it does anything in terms of survival, but it does make people more aware of what their baseline exam is like. Even going to a physician once a year, they're not going to remember exactly what your exam was a year ago.
Right.
You will. So it's more or less just paying attention to how your exam is at baseline.
How come women don't get checked as often as they should? I mean, what's the stigma there? Why is it so hard?
You know, I guess there's probably two different reasons. One, people may be afraid of what they're going to find. If you don't get a mammogram, you can't find out something is wrong. So ignorance is kind of bliss. So if they're afraid something's going to be wrong, it's a lot easier just to ignore the mammogram. But also there might be some fear that it's not covered or that it's expensive, or if you find something, you're not going to be able to afford it later. And there definitely are state and city programs that help with that. So there shouldn't be any stigma involved with getting a screening mammogram.
What about there's some women who get breast cancer in their 30s.
Absolutely.
So, but that's usually what? Past family history or something?
Usually. I guess there are some women who end up having genetic mutations or hereditary predispositions, but they usually have no idea that they have the hereditary predisposition. Mammogram isn't the best in women under 40 just because their breast tissue is more dense and the x-ray doesn't do a good job of taking a good breast picture. It's better for women over 40, and since that's really the most common ages that we see breast cancer. So under age 40, it should really be more of a self-exam, a clinical exam whenever you're in seeing your physician once a year, and then drawing your physician's attention to anything abnormal.
I've known women who have had breast cancer who've died.
Mm-hmm.
I've known women who've had breast cancer and was like they never even had it. It was such a, I don't want to call it a simple procedure, but their treatment was so, for lack of a word, simple that they just sort of went on with their life. Is that different cancers? Did they catch it early? I mean, how are we with treating this? It seems like we've come light years. So.
Yeah, absolutely. Especially over the past 30 years, it's a huge difference. But there's still nearly 300,000 new diagnoses a year, and we still lose 40,000 women a year in the United States alone who die from breast cancer. The best thing that we can do is catch it early so it hasn't spread from outside of the breast, outside of the local lymph nodes. That's what we can do to change survival. But it really comes down to tumor biology. Even women who are the most diligent about getting their mammograms, they can still end up with very aggressive cancers that even caught early are hard to treat.
Here's a stupid question for you. Is all breast cancer the same?
Nope. There's a lot of different things that we look at, how fast it's growing, how big it is, what it responds to, so we can know what targeted therapies we can offer, whether or not it's spread. So every patient is completely individualized. It's definitely not the same story.
But my father died of lung cancer, and he had a certain type of cancer in his lung. But if two people are diagnosed with breast cancer, is it the same cancer, maybe treated differently, or is it a different cancer altogether?
There's a couple different main types of cancer and then a handful of different subtypes beyond that. That doesn't make as big of a difference in terms of treatment, at least from a surgical standpoint. It really comes down to how big the tumor is, what the patient requests, what their comfort level is with the operations you're offering. So everything is totally different.
Right. And I guess the message is just if you get breast cancer, that's not a death sentence.
It's not.
Yeah.
It's not.
This woman I knew had breast cancer and just went about. She's like, "Oh, by the way, I had breast cancer." I was like, "What? Excuse me?"
Yeah.
She went through her chemo, didn't lose any hair, didn't miss a day of work. I mean, it was extraordinary.
No, there's thousands of women in the city of St. Louis alone that are doing the exact same story that you're speaking of.
Amazing. Okay. All right. So the bottom line is this: since this is breast cancer awareness, and we don't work for the Monarch Fire Department, we can say anything we want. Everyone's going to wear pink this month to bring awareness to it. You want to tell women what?
Over the age of 40, asymptomatic women with no breast complaints at all need to get a screening mammogram once a year and do self-exams often enough to know what your baseline physical exam is like. Women under the age of 40, no need for imaging unless you have an abnormality, and then you need to bring it to the attention of your doctor. But mammogram is definitely the gold standard.
Okay, and then quickly before we go,
Yeah.
men can also get breast
They
cancer.
absolutely can. It's only 1% of the population. There's no real imaging for them unless they have a palpable abnormality or something concerning. So men can definitely get it. If you notice a mass, if you notice some skin changes, if you notice something different on your chest wall, got to bring it to the attention of your doctor.
That is Dr. Theresa Schwartz, St. Louis University Cardinal fan. And I should know in my research for the interview, you're a fellow Big Ten grad.
I am.
Yes.
I did my breast fellowship up at University of Michigan. Go Blue.
I did my breast fellowship at the University of Nebraska. See, Big
Nice.
Ten.
Well
here.
done.
Thank you very much. I appreciate that. Dr. Theresa Schwartz, St. Louis University surgeon, world renowned. Thanks for coming in, Doc.
You're welcome. Thank you.
7:58. Quick check of traffic.